I'm Angela Fishman, licensed physical therapist and owner of My Pelvic Therapy, a telehealth physical therapy private practice. I'm here today to share with you the 5 things that you need to know to best treat your patient when they are not physically in front of you, such as during telehealth. Number 1, safety. Just because you're treating via telehealth and not in person does not mean that safety issues won't arise. So make sure that you have your emergency protocols in place. Make sure you have the patient's emergency contact name and number, as well as the patient themselves, their phone number, and their address, so that you're all set to go in case anything arises. Number 2, technology. Make sure you have a plan in place for when things go wrong with your technology, because at some point they will. So what will you do if, for instance, you can't see your patient anymore, or you get disconnected, or they can't hear you? Having a plan in place can really help for both you and your patient feel more comfortable in using this modality. It's also really helpful if you send ahead of time a best practices guideline for your patient so that they can ensure on their end that they're doing what they can to make sure that your session goes without a hitch. So things like making sure that they use Wi-Fi instead of using their cellular connection is helpful. Or making sure that they, in their own household, make sure nobody else is using the video, downloading any videos to play, like they're playing a video game, or downloading anything large from the internet during your session. These things can all help make your session much more successful. Number 3, privacy. It goes without saying that if you're a healthcare professional, that you need a platform that is HIPAA compliant to protect the privacy of your patients. But 2 other things to keep in mind is, are you keeping things private on your end during the session? Preventing coworkers from coming in if you're seeing someone at your office via telehealth, or if you're at home doing a telehealth session, making sure that family members are not within earshot or visual field as you treat your patient. And then finally, make sure that the patient understands their responsibility. So on their end, are they controlling who they want to have access to their health information? Number 4, efficacy. Learning to be effective while using telehealth instead of being in person can take some practice. So just remember, when you're using telehealth, you need to be laser focused and really use your keen observation skills in order to treat the patient. You'll have to catch some subtleties to see how is your patient responding to your treatment interventions. Sometimes we're not able to catch the same types of cues that we are from patients when we're looking through a computer screen as compared to being with them in person. So that takes a little bit of practice. Also consider, how do you communicate when you're talking with a patient through a computer? Do you use unnecessary hand gestures that are very distracting? Do you let your gaze wander? Do you look off to the side, maybe to take notes, which maybe that's what you need to do, but have you explained to the patient, this is why I'm breaking eye contact? All these things can make a difference as far as how to make your session as effective as possible. And also remember, not every patient actually is a good candidate for telehealth. So if you have somebody that you are not able to provide as quality of care as you would be able to do in person, it is up to you ethically to help them find in-person care. And one other thing to consider to make your session as effective as possible is do what you can to decrease your patient or your client's anxiety. So it's always anxiety provoking to see somebody for a health issue. So if you can take steps ahead of time to alleviate that anxiety, it can really help your session run much more smoothly. So very simple things such as making sure they know how do they navigate your patient portal? How do they make a payment? What should they wear to therapy or to their session? All of those things, if they have that information ahead of time, can really alleviate some of their anxiety. And finally, number 5, communication. Make sure that you are crystal clear with your patient what the goals are and what the expectations are for your sessions. If you leave a session without meeting what they think you're going to meet, it's harder to be effective. So just make sure that you're crystal clear with that communication. Also, it's very helpful to follow up every session with a written set of instructions. You may think that they heard what you said, but often by the time they're done, especially if it's a lengthy session, they're going to forget some of that detail. So make sure that they have written instructions so they have no questions. And with those instructions, make sure that you're crystal clear on what they need to do to follow up. Maybe they need to do a home exercise program once or twice a day. Maybe they need to phone another physician or another healthcare practitioner before your next session. But making sure that they know ahead of time what you expect from them and putting it in writing will help you be much more successful in reaching both of your goals for that session. So there you have it. These are 5 things that you need to know to best care for your patient when they are not in front of you. Thank you so much for listening.